आज मैं आप लोगों को बताना चाहता हूं कि यदि किसी व्यक्ति को अपेंडिक्स की बीमारी हो चुकी है, यानी ही इज सफरिंग फ्रॉम द acute or chronic appendicitis, then his treatment is done by doing the operation of appendix removal, and the name of the operation is called as appendectomy without any hesitation as soon as possible. अब हम आपको ये भी बता दें कि हम लोग अपेंडिक्स की डायग्नोसिस किस प्रकार करते हैं। इसमें फर्स्ट ऑफ ऑल जब हम पेशेंट की कंप्लेंट पूछते हैं तो पेशेंट बोलता है देयर इज सीवियर पेन इन द एब्डोमेन एंड मेनली इट इज ऑन द राइट साइड ऑफ द एब्डोमेन व्हिच इज एसोसिएटेड विद द वॉमिटिंग एंड समटाइम फीवर आल्सो। जब हम उस पेशेंट की जांच करते हैं तो हमें पता लगता है कि देयर इज ए टेंडरनेस इन द राइट आइलियक फोसा at McBurney's point, which is situated at 2/3 from the anterior iliac superior spine and the umbilicus 1/3. Once it is tender on this McBurney's point, the suspicion rises that this man is suffering from the acute appendicitis or chronic appendicitis. Now, in investigation, we do certain things like examination of blood, in which this complete blood count is very important, in which there is a raised amount of the total leukocyte count. If it is raised, our suspicion also rises accordingly, and then we advise the patient for ultrasonography of the full abdomen, in which we exclude the diagnosis of the perforation of the appendix as well as diagnose that whether this gentleman has acute appendicitis or not, and if required we can go also for CT scan of the abdomen, which finally tells us that he is suffering from appendicitis or not. Now once we come to know that the person is suffering from appendicitis, his operation must be done as soon as possible to avoid the complication of the perforation of the appendix, because as you know that once the perforation of the appendix has taken place, the dangerous and the threatening events will take place for the life of the patient, as he may lead the peritonitis and septicemia which will kill the patient. So it is my sincere advice that please go under the operation without any fear and hesitation on the opinion of the doctor, that the operation must be done as soon as possible. यहाँ मैं एक इंफॉर्मेशन और आपको बता दूं कि चाहे वह अपेंडिक्स परफोरेशन हो, चाहे वह गॉलब्लैडर का परफोरेशन हो, चाहे वह पेप्टिक अल्सर का परफोरेशन हो, in that condition the operation is always advised within 24 hours to save the life of the patient. Here I can quote one VIP, one film star who developed the perforation of the intestine after the blunt injury during the shooting. He was advised for the operation laparotomy and needful, but he didn't follow. He delayed the operation, and that is why it was very difficult to save his life. And although he was saved by a lot of management by the good doctors and the support of money, but he developed so many complications after that also. Here it is my sincere advice that you should follow the opinion of the doctor in such conditions. Healthy life is very, very important. In that way, stay healthy. धन्यवाद. Thank you very much.